Good morning to all of you. Previously, we discussed about the diuretics 1. In diuretics 1, we discussed about loop diuretics, thiazides, and carbonic anhydrase inhibitor. Today, we discuss about the potassium sparing diuretics and osmotic diuretics. So, let's see. Okay, so here there is a cortical collecting duct. Okay, this side is a lumen of the cortical collecting duct. Okay, this is the apical membrane. Okay, this is the basolateral membrane. We already know about this. Okay, so potassium sparing diuretics. Okay, aldosterone. First, we see the role of the aldosterone. We see the role of the aldosterone. So this aldosterone, it is a mineral corticoids. Okay, it is a steroids. Okay, it is a mineral corticoids. It is the corticosteroids, and it is acting on the mineral corticoid receptors, which is already present in these cells. Okay, and it is the part of the collecting duct. Okay, so it is acting on the mineral corticoid receptors. Okay, it's the corticosteroids type. Okay, it is the cytosolic. Then it's go inside the nucleus. Okay, there is a binding with the corticoid response element, and ultimately there is a formation of the various proteins, structural proteins. Okay, there is a transcription. Okay, and it increase the expression of this epithelial sodium channel. It also increase the Na plus K plus ATPase at the basolateral membrane. Okay, so how the diuretics, potassium sparing diuretic act? Let's see. Okay, so first one, there is a epithelial sodium channel. Here the epithelial sodium channel, it is at the luminal side apical membrane. So whatever the sodium remaining which is not absorbed from the proximal convoluted tubule or thick ascending limb of loop of Henle or the distal convoluted tubule, and then it is reached at the collecting duct. So this sodium, it reabsorb in our body by this epithelial sodium channel. Okay, by this epithelial sodium channel, it going inside the cell in the cytosol, and that cell, particular cell, there is a Na plus K plus ATPase at the basolateral membrane. Okay, so this sodium from the lumen, it go inside in our body. There is a tubular reabsorption of this Na plus. Okay, and second one, there is a potassium channel which is at the luminal side. It excrete the potassium. Okay, so we have the two types of the potassium sparing diuretics. One, it is the aldosterone antagonist, it is a spironolactone, and second one, the drugs which directly inhibit this epithelial sodium channel. It is a trimethoprim and amiloride. Okay, so we have the two types of the potassium sparing diuretics. One, it is a aldosterone antagonist, and second one, it is a epithelial sodium channel inhibitors. Okay, so this aldosterone antagonist, if we competitively inhibit this aldosterone, then ultimately there is a no combine with the mineral corticoid receptor. Aldosterone don't bind with the mineral corticoid receptor. Okay, so there is a no more formation of this epithelial sodium channel and Na plus K plus ATPase pump. So there is a no sodium reabsorption. Okay, and there is a no potassium excretion in at the lumen. So it is a ultimately potassium sparing diuretics. Okay, clear about it? Then the therapeutic uses of this, it is one of the diuretics. So it is a weak diuretic. It is acting on the collecting duct. So ultimately it is a potassium sparing. So we use this potassium sparing agent with the combined with the other diuretics. Okay, and ultimately if we want to overcome the hypokalemic action of the loop diuretics and the thiazide diuretics. It is also useful in the essential hypertension, but it is not as a first choice of the drug, but it is combined with the thiazide diuretics to overcome the hypokalemic action, and dose it is a 25 to 75 milligram per day. It is also useful in the heart failure, but it should be combined with the other diuretics. Okay, it having the anti-androgenic effect. So it is also useful in the hirsutism and polycystic ovarian disease in the female. It is also useful in the primary aldosteronism. If there is an increase in the aldosterone, then it is a aldosterone antagonist. So it is the useful in the primary aldosteronism or the secondary aldosteronism, which is seen with the nephrotic syndrome, hepatic cirrhosis, or heart failure. Okay, so it is as a useful as a aldosterone antagonist, this spironolactone. Then this spironolactone, it also the increase, there is a absorption of this spironolactone increase with the food. Okay, try to remember this thing. Then eplerenone, this eplerenone, it is a more potent than the spironolactone, and it is a laser ADR. We discussed the in next slide. Okay, so this trimterene and amyloride, it is a inhibitor, directly inhibitor of the epithelial sodium channel, and spironolactone and eplerenone, it is a aldosterone antagonist. But these four drugs, it is a potassium sparing diuretics. Two are the aldosterone antagonists and two is the epithelial sodium channel inhibitor. Okay, amyloride, it is a dose, it is 5 to 10 milligram OD or BD 2 times in a day. It is useful in the cystic fibrosis also, because it's maintain the adequate hydration of the respiratory secretion. Okay, it is also used in the lithium induced diabetes insipidus. Okay, it also block the entry of the lithium through the sodium channel in the collecting duct. So it is useful in the diabetes insipidus due to the lithium. Trimterene is the dose is 50 to 100 milligram daily. Okay, then let's see the adverse effects. So there is a potassium sparing diuretic. So there is a hyperkalemia. In loop diuretic and thiazide, there is a hypokalemia. With the carbonic anhydrase inhibitor, there is a hypokalemia, but here there is a hyperkalemia. Also there is a hyperchloremic metabolic acidosis. And this spironolactone particularly having the anti-androgenic effect. So there is a gynecomastia, breast enlargement in the males, there is an impotence in the male, and there is a menstrual irregularities in the female. It's due to the spironolactone. Eplerenone as a laser ADR than the spironolactone. Also with the spironolactone, there is a chances of the gastric upset, peptic ulcer, and confusion. Trimterene causes the nausea, dizziness, muscle cramp, increase in the urea level, and photosensitivity. Try to remember this muscle cramp and photosensitivity with this trimterene. Okay, trimterene causes the photosensitivity and muscle cramp. Spironolactone, there is a anti-androgenic effect. There is a gynecomastia with this spironolactone. Try to remember this particular ADR. Okay, amyloride causes the nausea, vomiting, diarrhea, and headache. Let we discuss the osmotic diuretic. How this osmotic diuretics, it is effective. Okay, so there is a glycerin or glycerol, mannitol, and isosorbide. Mannitol, it is useful by the intravenous route, and glycerin and isosorbide, it is given by the oral route. Site of the action, then it is a loop diuretic. It is acting on the thick ascending limb of loop of Henle. Thiazide, there is a distal convoluted tubules. Okay, collecting duct, there is it is a spironolactone, trimterene, amyloride. Okay, in PCT, proximal convoluted tubule, there is a carbonic anhydrase inhibitor. So again, this drug osmotic diuretics. Okay, this osmotic diuretic, glycerol and mannitol, it is acting on the proximal convoluted tubule also, and descending limb of loop of Henle. This both side, it is freely permeable to the water. Try to remember this sentence is freely permeable to the water, and this mannitol, glycerine, it is a filter in the glomerular filtration, and it is acting on the proximal coronary tubules and the descending limb of loop of Henle. Try to remember this thing. Okay, if we want to talk about the mechanism of action, so this is the osmotic diuretics, mannitol, glycerin, isosorbide. It is a hydrophilic compound. Okay, it is a freely filtered through the glomerulus, but it is not reabsorbed. So it is a retained in the renal tubules. It is a hydrophilic. It is easily filtered but not a reabsorbed. So it is remain inside the renal tubule, and increase osmotic pressure. Okay, there is a increase osmotic pressure, so there is a increase in the urine. Okay, increase in the urine. It also having some other mechanism, like it inhibit the transport process in the thick ascending loop of Henle, but there is a not clear mechanism. It also inhibit the renin release and increase the GFR, because it increase the fluid from the intracellular to extracellular fluid and increase the urinary output. Okay, so this osmotic diuretic, try to remember name, it is a glycerin and mannitol. Okay, it is the highly efficacious 20%. In previous video, there is a we put in the weak efficacy, but it is a some higher efficacy than the other diuretic. But most efficacious diuretic is a loop diuretic. Try to remember this thing. Loop diuretics is a highly efficacious. Then there is a this osmotic diuretics, then thiazide, okay, carbonic anhydrase inhibitor and other. Okay, so let's see the indication or therapeutic use of the osmotic diuretics. Okay, these osmotic diuretics, it is useful in intracranial pressure. Some condition in the there is an increase in the intracranial pressure, like the stroke, head injury, or after the post-operative procedure, neurological procedures, because it decrease the extracellular fluid, it decrease the volume, and there is a decrease in the pressure of the intracranial. Okay, it also decrease the intraocular pressure, so it is useful in the acute glaucoma also. Okay, it decrease the formation of the aqueous humor. Also, it is useful in the acute renal failure to maintain the high urine flow. It particularly some renal condition like the rhabdomyolysis, or it is due to the hemolysis, but it is not a very much useful in the acute tubular necrosis. Also, it's useful in the hemodialysis induced the hypotension. If there is a rapid hemodialysis, then there is a chances of the decrease in the extracellular fluid volume, and there is a hypotension, there is a headache. So it is useful in the hemodialysis induced the hypotension. Dose is a mannitol intravenously, it is useful, and 10 to 20% it is given. ADR की बात करें, then it's a nausea, headache, vomiting, or sometimes there is a hypersensitive reaction with this osmotic diuretics. Okay, contraindication की बात करें, then it is not given in the various if there is a heart failure, there is a cerebral hemorrhages, okay, acute tubular necrosis, so it is not given some these conditions. Glycerin, it is a orally useful osmotic diuretics, and it is a 0.5 to 1.5 gram per kilogram. It is useful as a oral solution. Okay, so these are my references for these videos. Thank you.